What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I really hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, October 26th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all things COVID and all those other viruses that could make you sick. Let's face it, COVID is something that has not ended. It's been going on since 2020, in fact, maybe even 2019. And it never fully went away. We never did our job to eradicate of this virus, and it's something that we are stuck with right now. Other viruses are coming into play because we're heading into the colder months, which, quite frankly, you mix that up with COVID, it's going to be a big strain on the hospitals once again. So if you want to stay informed with what's going on with all these viruses, maybe you clicked on this video because you are sick right now, or you know someone who was sick during the summer wave of COVID, or you just want to be informed with what's going on. Subscribe down below. Give this video a thumbs up. Hit that notification bell and share this video with anyone you know. Alright, we do have another busy news day today, partly because we have a couple things that we need to look at that we did not get to yesterday, and of course there's just a lot of things I want to show you. So starting off with this study that comes actually from a hospital in my area of Philadelphia. And this is not good news. We're always constantly finding out things that this virus, COVID, can do. And it says, virtually all children infected with COVID-19 show signs of blood vessel damage, study shows. And I want to read to you the first paragraph. Philadelphia, Pennsylvania. The news about coronavirus and children just got a lot worse. A troubling study by researchers at the Children's Hospital of Philadelphia reports a high proportion of children infected with SARS-CoV-2 show elevated levels of a biomarker tied to blood vessel damage, making matters worse. This sign of a cardiovascular damage is being seen in asymptomatic children as well as kids experiencing COVID-19 symptoms. This is not a good thing. If you want to read this full study, I did tweet it out, and of course it will make it over to my website, datareport.info, and you'll be able to see it in the COVID in kids studies section. I'll make sure I get it there, and I will be showing you my website in just a moment. Alright, Grateful Dead bassist, original founding member, Phil Lesh has died at 84. You may recall, now they're not, let me back up for a second, they're not giving a cause of death. You may recall in a pandemic update back in the summertime, we talked about Phil Lesh. Why did we talk about Phil Lesh back in the summertime? Well, because he did have COVID this past summer, and I was driving around doing deliveries this morning, and I was reminded that Phil Lesh died. I had read yesterday that he died, and I was reminded by listening to the radio, Sirius XM, the classic vinyl station, Earl Bailey, who's one of the DJs there, talked about it. At least I think that's the channel I had on at the time. Anyhow, it was just bothering me. I said, I know I posted something or reported something on Phil Lesh. So I got home, typed into my website, you can go do search right here. You can type in Phil Lesh. Watch, we'll do it right here. Here's how easy it is. And watch what happens. And it came right up, and I said, dang nabbit, I knew it. He had COVID this past summer. So here we are, Phil Lesh, who is one of the original founding members of the Grateful Dead, and now a founding member of Phil Lesh and Friends, tested positive for COVID sometime around August 17th or 18th, 2024. At the time of testing positive, he was 84 years old. We don't know what happened at the time in between, but we do know now he has died. So, sadly, Phil Lesh, who's a fantastic musician, did pass away, and of course I will update this thread to reflect that he died, and I'll do something. I'll either post it in Celebrity Deaths or somewhere else, but unfortunately he died, and I don't know that I'm going to be putting him in died of COVID until hey, maybe one day we do find out that he never fully recovered. Alright, moving on to this. Remember, this is an update, a little sports report here. 49ers receiver Deebo Samuels better, but his status is still uncleared. What they mean by better is he was dealing with pneumonia, and he is now out of the hospital. So there's the update on Deebo Samuels. Alrighty, moving on to this now. In Montana, there is now, for the first time in a portion of Montana, in its Flathead Valley, an infected deer has tested positive for chronic wasting disease. So chronic wasting disease now being reported in Montana's Flathead Valley, and this is a white-tailed deer. All right, taking a look at Wastewater Scan's weekly thread where they talk about different virus levels in the United States. COVID-19 nationwide, SARS-CoV-2 is in the medium category, they say, with medium concentrations and a downward trend over the last 3 weeks. Notably, the South and West are now in the low category. So that's good news, but we'll have to see how long that actually lasts at this time. And you can see here, if you take a look at their chart, it does look like the Northeast may be starting to rise. No, not that big wonky upward movement, but there may be a sign of a change coming in the tide soon. We're not seeing it in the cases yet, but it could be coming relatively soon. COVID-19 variants in sequencing data from a subset of wastewater scan sites, we see that the KP family makes up 54% of variants. KP.1 in the lime green is at 7.2%, KP.2 is at 7.4%, KP.3 light blue is at 39.2%. Sequencing data has a lag of 1 to 2 weeks after collection. And now they're not showing XEC, but we will take a look at the XEC variant from the CDC in just a little bit. RSV nationally and in all regions, RSV is in the low category and not in seasonal onset. So they're saying, remember, if we go to their website, we saw something different yesterday. However, the rate of detection has increased modestly in the last couple of weeks, especially in the South. That's what I was just referring to. In the South, if we take a look at their charts, we can see it looks like it may be starting to rise. And yes, it is still low, but should that rise continue, well, that could change to medium maybe. Influenza, flu A and flu B is in the low category nationally and in all regions. I expect that will probably stay the same for another week or two before eventually changing. And H5 influenza marker H5 has been detected in 9 states since the start of monitoring, and that's pretty much the same as it was last week. And then we do see here EV-D68, and EV-D68 is now monitored as a seasonally detected pathogen. It's in the high category nationally as it's in onset at a high concentration with a downward trend. All regions are in the high category. In the last 10 days, it was detected in 78% of tested samples. Norovirus is in the high category nationally with a medium concentration and an increasing trend. Yes, we have been watching that go up. Alrighty, moving on here. In case you did not see the UK this week, their cases were down by 446. 3,067 cases were reported, 199 deaths. That was up by 22.1%, or 36. Patients in the hospital, 2,622 people were admitted, and that was up by 149, or 6%. And I do not have an update this week for Italy. I did last Saturday. I haven't seen anything. I Google searched it. I checked on X from the usual source that I usually look at. Didn't see anything posted, so maybe in the near future we'll get an update on Italy. Taking a look now at pollen levels, 62% of the country is in the low status, yellow down in the south. Alright, taking a look at purple air, but before we continue, that's if it does update, because let's refresh this. I had a comment about purple air yesterday, and how sometimes when I have the map zoomed out, it shows red for an area that's not really completely red. There we go, it finally came up. And that is true. Like, for example, look at Los Angeles. It's showing widespread red. But if I zoom it in, you can see here, it's not actually just covering the whole area. There's also orange surrounding it and some yellow. So, yes, that is definitely a problem. And I do also agree. The person also stated about how sometimes it does not match other maps. I have noticed that as well. Key takeaway is there are still some areas of bad air quality on the West Coast and in the southeast. Sometimes this doesn't match up with other maps, and who knows, maybe once I put to rest for the season the pollen map, maybe what I will do is I'll have 2 different maps so we can get two different perspectives of air quality. Moving on now to my other thing that you could follow if you want to. Climate data report over on X and climate data report over on Blue Sky, where I talk about all things weather. Didn't get to post much there the past couple days. I am going to make an effort to post there this afternoon. And here's my other channel, Climate Data Report. Let's refresh this. And this is over here on YouTube. I was going to post a video there today. Not certain if I will get to that. If not, I'm definitely doing one tomorrow. Not much has changed, but I'll talk about the latest weather news and what I see happening in the near future. All right, moving on now. Taking a look at Philadelphia yesterday, 801 EMS incidents were reported. So again, that's not much of a change. Yesterday, for Thursday, they reported 799. I do have to show you this, though, and I hope Philadelphia is not the same. Montgomery County this afternoon has been extremely busy. Just earlier, before I started this video, Montgomery County was at 22 active EMS calls. I hope that is still not the case. It looks like it's down to 14 now, but it's been a very busy afternoon. We're seeing a lot of calls for falls, general weakness, vehicle accident, not seeing respiratory emergency, or, well, there is a cardiac emergency, but again, it's been very busy, and let's see what's going on in Chester County. Looks like Chester County has some calls as well. We're seeing stroke a couple times, seeing sick person show up. Yes, problems there. Seeing heart problems, West Brandywine Township. So yes, it's just a busy day for EMS calls, and even though Montgomery County has dropped 14 for Saturday, that is still a relatively high number. Tonight, I suspect it'll be high. Why? It's Halloween weekend. What does that mean? Well, Halloween weekend's a big weekend for parties. Some will have a little too much to drink. There may be falls, maybe, all kinds of stuff that pops up. Alrighty, let's take a look at the percentage of emergency department visits with diagnosed COVID-19 in the U.S., all ages, and we're looking at all regions. Unfortunately, we cannot do every state. Not every state is listed here. Maybe when the hospital mandate comes back, we'll gain some of those missing states. Missouri continuously is one of them. All right, starting off with the United States nationally. Again, people diagnosed with COVID showing up at the emergency department. You can see it is still dropping. Nationally, it is. That has slowed off a little bit, but we're going to see some states where that drop it's really slowed off, or maybe even trying to start to rise once again. Alabama, it did start to slow off, but then it started dropping more again. Happy about that. Not happy about Alaska. Take a look at this. Alaska, it has slowed off, and maybe even a sign of it starting to rise there. Arizona has slowed off a little bit, but it is still dropping. Arkansas, it was dropping. Look at this. We're seeing the first signs of a rise now in Arkansas, which, quite frankly, to me is a little bit of a surprise because they're a southern state. Don't usually see the southern states start up for a COVID wave first when it comes to the colder months. So that's something we'll have to keep an eye on. California is continuing to drop at this time. Colorado is continuing to drop. Connecticut's still dropping, but you have slowed a little bit. Delaware, also still dropping at this time. DC is still dropping. Florida dropping. Georgia, look at this. Once again, slowed off, and I mean, you're pretty much following the footsteps of Arkansas. You're not rising yet, but this signals you could rise pretty soon. Guam is still dropping. Hawaii is still dropping. Hawaii got hit really hard in the summertime. You can see that percentage went almost up to 6%. I mean, that's just crazy. And Idaho is still dropping at this time. Illinois is still dropping, but you can see here it's starting to bottom out, and maybe pretty soon it may turn and start going up. Same with Indiana. Iowa is still dropping. That has slowed a little bit. Kansas is still dropping. Kentucky dropped, and then it started going up a little bit, but now it looks like maybe it's starting to drop again. We'll have to keep a close eye on that one. Louisiana is still dropping. Maine is still dropping. Maryland, you have stopped dropping. You have leveled off now. And hopefully maybe you'll start dropping again, but we'll just have to wait and see. Massachusetts slowing off a little bit. Michigan still dropping, but slowing off a little bit. Mississippi still dropping. Montana still dropping. Nebraska, look at this. Now, this would not be your first time. Nebraska dropped, then it stopped dropping, then it rose a little bit, then it dropped again. Now it's trying to rise once again. We'll have to see what happens with that. Nevada is still dropping. New Hampshire is still dropping. New Jersey is still dropping. Slowing off a little bit, but for the most part still dropping. New Mexico did slow off. Then they rose a little bit. Now they're starting to drop once again. New York is still dropping, but it has slowed slightly. North Carolina is still dropping, and we do see North Dakota. It tried to go back up a little bit again, but now it's trying to go back down. It's no real clear picture there. Ohio, at this time, is still dropping. Oregon is still dropping. Pennsylvania starting to slow off, and we will see some new death numbers from Pennsylvania in a little bit. I'm not happy with the number of deaths that are being reported in my state. Stay tuned for that in about 2 to 3 minutes. Rhode Island at this time was dropping. Now it's starting to rise slightly. You're getting a picture here. We're starting to see the early indications of the next wave, and should more states start to join the party of slowing off and starting to rise, you know what's going to happen. That national level will start to rise. South Carolina still dropping, slowed a little bit, but it is still dropping. South Dakota was dropping, now it's starting to rise a little bit. Tennessee still dropping, even though it's slowed a little bit. Texas still dropping. Utah still dropping. Vermont is still dropping now, finally. Virginia is dropping, slowed off just a little bit. Washington still dropping. West Virginia still dropping. Wisconsin is still dropping at this time. And Wyoming, nothing for you. And again, I don't think we mentioned Missouri. Did we? No, we did not, because Missouri is simply, for whatever reason, they don't contribute to this. I don't know why. All right, taking a look now at the national wastewater, which will probably go much deeper in depth tomorrow. The big takeaway right now is there are now 408 very low sites for COVID that are at 0 to 19%. And you can see here, let's go up to the Northwest. I promised we would look at this. We'll look at it again this weekend. Those orange sites, those are moderate to high sites. Light blue, that's near moderate. But the dark blue sites that you do see here, those are very low levels of COVID, and there is one that is in the red. What's red? Well, red is 80 to 100% detection of COVID. That means, whoa, a lot of people in that area are testing positive for COVID or have COVID at this time. And we'll look at the rest of the United States tomorrow real quickly, though. You can see California, there's a lot of blue, that's good. And there's also a lot of blue in New York State and Illinois, so I'm happy about that. I mean, we're finally back up to a high number of blue sites, but it's not going to last. As we get closer to the holidays, or as we get to the holidays, that number is going to drop significantly, and the number of red and orange sites will significantly go back up once again. Alrighty, moving on now to epidemic status. And we want to take a look at COVID. COVID is now likely growing for epidemic status in New York, Michigan, Ohio, Kentucky, Tennessee, Arkansas, and in Georgia. And we just so happen to have mentioned some of these states starting to see the turnaround for people turning up positive for COVID at the emergency departments. Arkansas, Georgia, yeah. Arkansas, we saw you starting to rise. And influenza, we can see here, there's a lot of places where it's likely growing or is growing at this point. All right, we have quite a few more things to get to. Taking a look at some data now from CJS 83172. Daily weekday reporting states. Florida reported 271 new cases. This is yesterday. Now, he put this comment yesterday, so wherever it says today, I'm going to say the words yesterday. And 2,270 cases and 132 deaths reported this week, a number of which came in from July. Yeah, well, don't know what that's all about. We randomly see states do this sometimes. New Jersey, 274 new cases added today and 2,086 cases and 17 deaths this week. New York, 657 new cases today and 4,034 cases added this week to go along with 49 deaths. Puerto Rico, 102 new cases reported this week, yesterday, their highest number in more than 2 weeks, and 418 cases and 4 deaths this week. Alabama, 20 new CDC reported deaths. California, 2,397 new positive tests and 85 new deaths. Idaho, 350 new emergency department visits. Illinois, 20 new COVID deaths. Louisiana, 681 new emergency department visits and 11 new deaths spanning past 2 weeks of reporting. Missouri, 28 new CDC reported deaths. Mississippi, 11 new CDC reported deaths. Montana, 339 new cases and 8 CDC reported deaths. Pennsylvania, 46 new deaths reported. That is a horrible number for my state. How is my state still reporting near 50 deaths a week? I mean, that's just ridiculous. South Carolina, 26 new CDC reported deaths. And you know what? For the size of South Carolina, that's ridiculous as well. A lot of these numbers are. Texas, 1,115 new cases and 29 new state reported deaths. Wisconsin, 815 new positive tests and a 6.7% test case positivity rate and 19 CDC reported deaths. West Virginia, 694 new positive tests and 18 CDC reported deaths. Thank you so much for providing us with this data, CJS 83172. I hope you have a fantastic weekend. Take some time off. You deserve it. You had a great weekend, and I will look forward to your reports again next week. All right, skipping New York State today, let's look at New Jersey. 229 people in the hospital with 67 out of 70 hospitals reporting. Finally, getting to Los Angeles, and we see here hospitalizations are dropping. Deaths are slightly starting to go up again, but overall deaths are dropping there. Cases have dropped, and testing is dropping at this time. In other words, meaning the positivity rate, it's still dropping, but it has slowed off a little bit. Wastewater still dropping. Emergency department visits, look at that. They level off a little bit. We'll have to keep an eye on that. And for COVID-19, the positivity rate, it says here, the positivity rate change is 3.5%. That's down by 0.3%. Flu is 1.6%, up by 0.1%. And RSV has a positivity rate of 1%. And wastewater concentrations for COVID at this time stay low and decreasing. That is some good news. Alrighty. That was a big update today, wasn't it? We got through a lot of stuff. I hope you enjoyed this update. If you did, give it a thumbs up. If you're new to my channel, hit that subscribe button down below, hit that notification bell, share this video with anyone you know, and of course leave all of your comments down below. We've talked about a lot of different things today. I'm sure there is going to be some comments on something that I discussed today. I will see you all again tomorrow. Yes, there will be a Sunday update. We'll see what news pops up. Who knows? It's been busy lately. And, of course, we will definitely try to get at least somewhat of a wastewater update out there. You know, we'll go site by site, but it depends on how much time there is. If there's a lot of news, it's going to be shortened for that aspect. So I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.